Well, in the past months, we've seen groups like Operation Dudula and March in March chasing away undocumented migrants from government health facilities. The Bekisisa Center for Health Journalism says this threatens the gains made in fighting HIV over the past decades. The organization warns HIV infections might rise as a result. Well, let's discuss this now with Bekisisa Editor-in-Chief, Mia Malan. Mia, good afternoon. Thanks so much for your time. And, I mean, this issue of undocumented foreign nationals accessing healthcare, we know Operation Dudula, March in March, and what's been happening in recent weeks. And let's talk HIV specifically now. How is denying foreign nationals treatment affecting our fight against HIV? What are we seeing?
So, Uveka, first of all, it happens against a very bad background in the sense that we've already seen funding cuts from the United States this year, and those funding cuts served groups often like migrants to access healthcare if they couldn't do it, if they were discriminated against. So now we already don't have that. Now, here's how HIV works. We still have 400 new infections each day in South Africa. And that is a lot less than we had 20 years ago when it was about 3 times as much. The main reason why those infections have gone down is because we have rolled out antiretroviral treatment. Because that treatment doesn't just keep people healthy, it reduces the amount of virus in someone's body to such a low amount that they can't infect other people. Now, research shows us that the way to deal with HIV now, to bring the pandemic to an end, is to focus on groups that have a higher chance than the general population to get HIV. And one of those groups are migrants. Just as you saw in your previous interviews, they don't have stable places to live in, they have stressful lives, and that often leads to environments where they need to make choices that they wouldn't have made otherwise. So migrants are specifically a group to focus on. So to prevent them from accessing treatment means that you don't test them, you don't put them on treatment, and you don't prevent the spread of HIV. Now, when people have sexual relations, they don't stick to citizenships. So in a country, it doesn't make scientific sense to do that.
Yeah, and that was exactly my next point to you, is that we have, illegal immigrants or those foreign nationals who are undocumented, and they are in relationships, like you say, they are in sexual relationships with South Africans. That is a reality. There are children that are born out of these relationships as well. So what do we do? I mean, it obviously sounds to me like it's time to rethink the legalities around these treatment issues, because we know the NHI Act says they're only entitled to emergency care. They can't get free HIV treatment.
So that NHI Act has, of course, not been promulgated, so it hasn't yet been rolled out. But the law at the moment says is that those people should have access to primary healthcare services for free. But if we look at the future, the NHI Act says that when it comes to undocumented migrants and asylum seekers, they can only get free access to health services if it is a notifiable disease or an emergency. Now, a notifiable disease is a disease like TB that spreads, that's a serious disease, and it spreads very quickly. And because the government wants to keep track of who has TB where and who's getting treated, a notifiable disease means that if you get diagnosed, your name gets sent to government, some of your details get sent to government or the health department. Now, in South Africa, HIV is not a notifiable disease for a range of reasons. It's a serious disease, but because of stigma, we haven't made it a notifiable disease, because the argument is if you tell people their names are going to be sent somewhere, they will probably not even come for testing. And that means, as the NHI Act stands right now, people, asylum seekers and undocumented migrants won't get access to antiretroviral treatment or any HIV services. And that is disastrous. Now, I must say the Health Minister has told Bekisisa that he's prepared to change that part of the Act. Of course, he can't change it alone. It would have to go through a parliamentary process. But he supports the science that backs it, that everyone should have access to HIV services.
Now, well, Mia, in the meantime, where we've seen, them being prevented from actually getting to healthcare facilities for whatever treatment, obviously HIV treatment would fall under that. I mean, how far back do you think we've been set? How big is the setback when it comes to infections? I mean, I'm looking at figures in your article here. There are about 400 new infections a day, although we seem to have most of it under control.
We have 400 new infections a day, and they are indications that those infections are starting to go up because we no longer have the US government support for projects that specifically deals with groups with higher chances to get HIV. We are looking next year to roll out injection. The health department may start with it in April that can prevent HIV infection. You take it once every 6 months. But I think it's also very important that we change the narrative. There is a narrative going around that our public health system is not in a good state because there are so many foreigners using our health services. We know that's a very small percentage of people using our health services. We should rather focus on the larger issues, on corruption and bad management, and fix that so that everyone can have access to services.
Well, if these things don't happen, Mia, where do you see this going? Worst case scenario, especially for South Africans?
Well, I think we're going through a really difficult time in South Africa, not just us, the entire Africa, with a very sudden funding cuts. So when it comes to HIV, where we're moving towards now is to look at readjusting our program, looking at different ways of revenue, different donors, but also different ways of getting the money locally. Now, of course, those amounts of money that we got from the US government were large amounts. We'll never be able to replace it. But we need to look at a plan over a period of time. And that is slowly starting to happen, of what can we do. And obviously, we also need to focus a lot on prevention so that we don't have to focus so much on treating so many people.
Well, Mia Malan, it'll be very interesting to have a conversation with you in a couple of months to see exactly where we stand with all of this and what is happening with those numbers. We'll be sure to book that date with you. Mia Malan from the Bekisisa Center for Health Journalism. It is all angles here on eNCA on this Friday afternoon. More of your top stories coming up on the other side of these.